This is a story that came out on CTV News in Canada. British Columbia Premier says opioid crisis is scourge after reports of 130 overdoses in one day. That is outrageous. So this story came out July 30th, 2018. So they just go to show you in Canada, they're not really doing any better than here in the US. One of British Columbia's top addiction experts joined Premier John Horgan Monday in calling for increased efforts to fight the ravages of illegal drugs used after a report of 130 overdoses in one day last week. Wow. Woo! Horgan said he's thankful there were no deaths from any of the overdoses reported on Friday, but the staggering number reveals the amount of work ahead to battle the crisis. Dr. Evan Wood, director of the British Columbia Center on Substance Use, said the unofficial number of overdose cases was likely much higher last Friday, as injection site volunteers, public and private citizens, and other drug users helped others in distress. Just like here in the United States, they lowball the number. They don't want you to know what the real true number is. But, even a conversation with my doctor told me that it's way higher than any number that we're hearing. If there were 130 ambulance calls, you could imagine there were many other overdoses where there were other drug users offering naloxone or service workers providing naloxone, he said. Naloxone, widely available in British Columbia, is a life-saving medication that can stop or reverse an opioid overdose. British Columbia Emergency Health Services said paramedics responded to 150 suspected overdose calls on July 27th. A statistic only seen once before in April of last year. The service said in a statement on Twitter that news about the high number of overdoses should be made widely known, and it urged drug users not to use substances alone. Yeah, because that's how they can die. To think that happened 130 times last week on one day is staggering for the public and speaks to the amount of work we have to do to get this scourge out of our cities and out of our province, Horgan said. With respect to the timing of this last rash of overdoses, it strikes me these numbers of unprecedented, and our job is to make sure we're doing more in the days ahead. The premier said the province is working to ensure paramedics have the tools to help people who overdose and that recovery facilities are able to help addicts to receive the care they need quickly. Wood said he agrees with Horgan that more needs to be done to battle the overdose crisis. We need more of everything in terms of what the premier is saying, said Woods. We need more effective harm reduction services. The big gap is being able to go into harm reduction services and steer people to get them off toxic opioids. Well, good luck, because they're sure struggling with that here in the U.S. And as you can see, it's no different in Canada. And they have injection sites up in Canada. In fact, that's where the U.S. got the idea to do injection sites here in this country. He said the wider healthcare system itself must turn towards addiction treatment after decades of unfocused attention. In the same way, that primary care physicians can see somebody who has high blood pressure or who has been pregnant or who has diabetes, they need to be able to say, okay, I know exactly what we need to do, said Woods. It took a long time to get into this mess, and it's going to take some time to get out of it. The latest BC Coroner's Service for provincial overdose numbers posted on June 25th include 109 suspected illicit drug overdose deaths in May, a figure 23% lower than the overdose deaths for May 2017. The Coroner's Service stated that there were 620 suspected overdose deaths up to the end of May this year. There were 1,449 overdose deaths in British Columbia in 2017, the Coroner's Service reported. So they're no better off in Canada as they are here when it comes down to the opioid plague that's going on. Please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.